Hey feds, I want to give you this one comment. Today's not a question. It's a comment that someone had. And we were talking about medical benefits. And they said that they have FEHB and they have Medicare Part B. I don't know what I was thinking. Brain lapse there. But Medicare Part B is what they have. And in retirement, what happens with Medicare Part B is it becomes the primary and it pays 80%. And then your FEHB pays the 20%, but you are paying two premiums at the same time, which a lot of people don't like, right? Totally get that. Why pay for two things when you don't need it? Well, maybe you do need it. And the comment was that this person is doing this, paying two premiums at the same time just for peace of mind. Because if Medicare pays 80% and then FEHB pays 20% and you don't have to pay anything out of pocket except for two premiums, you know exactly what's budgeted. You know exactly what's coming out every month in that year and going toward healthcare and nothing else. If you get some big, bad, horrible something, it's not going to eat into your budget anymore. So for that peace of mind, they are doing both types of health insurance. And that's something that you really want to think about. It's not just, can I afford something, but it's also, what will give me peace of mind when I retire? Something to really think about. Come to our workshops and you can learn some details around what will give you peace of mind and what you thought would give you peace of mind, but actually it doesn't. And it's a little bit more complicated than you thought it was.